Hello, everyone. My name is Arvind, and I'm a medical doctor currently pursuing a PhD in surgical robotics at Melbourne University. Now, I was previously training to be a neurosurgeon back in Malaysia, but I had a change of heart and decided to move to Australia in what I would describe as a change of career. Now, after arriving here in Australia, I was based at the Royal Adelaide Hospital, where I essentially had to restart my entire career from scratch. I spent some time in various surgical disciplines, namely urology, renal transplants, ear, nose, and throat surgery, and so on. Back in 2015, I then decided to pursue a career in research. I ended up in London at Imperial College, where I did a Master's of Research at the Hamlin Centre for Robotic Surgery under the supervision of Professor Guangzhong Yang. As part of my research, I worked on specialized fiber optic sensors as shape sensors for continuum robots. So this was a fairly exciting sensing modality, which I am currently applying in my PhD. In the long run, I intend to apply my extensive knowledge and skills in image-guided intervention and medical robotics from a research and development perspective. Now, with regards to what challenges I faced as a trainee, well, there's two aspects of it. One is as a medical student, and the other one would be as a trainee surgeon. I would say the lack of simulation devices or tools or instruments that smooths the transition from learning physical examination of patients, but more so in performing diagnostics. Now, you usually learn this from your supervisors with regards to examining patients, and that could be fairly solvable. It requires a lot of practice, seeing a lot of patients, repeated physical examinations. So that's something which is one could surpass it. But I felt that the difficult part was actually in performing diagnostics. You usually learn it from either books or manuals or from your trainee supervisor. But then you got to apply it with patients. So the actual process of actually applying it, making it transition from theoretical to the practical, when you're talking about diagnostics or therapeutics, that can be very challenging. And there's this concept where you observe your senior or your supervisor a few times, and then you perform either the examination or the diagnostic procedures. Now, obviously, there was a time where this was acceptable, not in these times. So I would say we need some sort of medium. A lot of it is already in existence, but can be improved. So what kind of training technology do I use at present? Well, in the past, I've used the American College of Surgeons functional laparoscopic surgery kit to essentially train myself to improve my laparoscopic handling of instruments. There's also a virtual reality, which I became familiar with whilst I was at Imperial. The one I recall was a virtual reality simulation for a robotic practice. That was a good opportunity to actually use what would you call a joystick, or the hand manipulator, and get the objects moved from one location to another location, or transfer objects from one instrument to the other instrument. Of course, that lacked haptic feedback, so it was tricky. It was mainly based on visual feedback. There's also one where, in terms of using mannequins or models for ear, nose, and throat examination. So in the case of using a flexible nasal laryngoscope, so we're a mannequin where we can actually insert the flexible scope into the patient's nose, all the way to the back of the nose, and then guide it downwards into the throat and into the gullet. So that was fairly helpful in actually helping me for one to better handle the endoscope, as well as learning the maneuver techniques to look at certain anatomically constrained areas which would need to be replicated in a patient. Now, in future, what I would like to see in training is essentially a validated motion metric analysis for data and analytics to objectively assess clinicians' handling of instruments. And the reason is essentially to stratify the skill set of the clinician. And also, these motion analyses can be used to optimize the design of robotic manipulation, because there's a lot of data that you get from these motion analysis. And I suppose I'll give you an example where it's lacking at this stage. So if you recall, I spoke about the American College of Surgeons functional laparoscopic surgery, which is essentially a box with holes where you insert your instrument into the box. You can't see the items inside the box directly, but through a video. And then you use that instrument or training kit to improve your handling of those laparoscopic instruments. And at one angle, it could be right in front of you. You've got a 3D camera or time-of-flight camera which shoots infrared waves, which hits your wrist, and then back to the camera. And this is then interpreted as motion analysis. Depending on your algorithms, you could get the speed, velocity, smoothness of movement, the acceleration, or the economy of motion of the handling of the instruments. It would be nice to have that for training of ENT trainees who use the functional endoscopic sinus surgery, whereby one hand is used to hold the camera on the left side, and on the right side, you use an instrument. And whilst performing the procedure, you're actually looking at a screen, because you can't actually see into the nasal cavity of the patient. So you got to see a video screen of what's actually happening inside at the same time, handling the video, the endoscope and the instrument. So there's a mismatch between what you can see and maneuvering the instrument. So it's tricky to learn the visual spatial skills in this aspect. Well, that's all I have to say in this brief video. I hope you found it helpful. Thank you very much.